Rikers Island is an island. There are jails on Rikers Island, and there's a jail. There are other jails in the city. There's one in the Bronx. There's one in Manhattan. There used to be one in Brooklyn. It closed down recently. So I worked there from 1981 to 1986 as the director of the medical and mental health services. Mm-hmm. I'm a doctor, and I worked there as a doctor for a year, and then I worked there as the director of the program. And now for the past 10 years, I have been on the Board of Correction, which is an independent sort of. It's a political. It's appointed by the mayor and the city council, 9 members, and we have I have a badge, and I have 24/7 access to all the jails, and we theoretically have access to all the information that exists. Mm-hmm. For example, we're linked to their computer systems. We are linked to their cameras, so we can watch what's going on in Rikers Island all the time. Mm-hmm. We have a staff of 25 people, but we have not been on the island for the past couple of months, but started going back last week.
My question is in general, because I was told that it was a very violent place. Did it change, or is it still? Do they have a lot of problems of violence just now?
In terms of right now during the pandemic, or just generally in this period? Oh no, it has always been a very violent place, and there is currently a federal monitor appointed, which is the prisoners and their lawyers brought suit a number of years ago because there was so much violence in the place, which was due to actions by the security staff, unprovoked violence by the security staff against the men and women living there, particularly the men, resulted in actually the installation of thousands of cameras. 8,000, 9,000 cameras had to be placed. Every incident of violence has to be investigated right now, and it is still a violent place, and was when I was there as a doctor 30 years ago as well.
Now, what are the big? Because I read that the infection rate in Rikers Island is like 7 times higher than in the city. So, is it like this now, or how is the situation just now? Because you said that you just visited now. No?
Well, the health provider, the city of New York, actually refuses to let us know what the actual rates are. They, for reasons that I don't agree with and actually don't understand, because they don't explain it, refuse to tell us how many people have been tested, for what reasons. So we cannot tell from the numbers we have exactly the extent of the infection rate on Rikers Island. We know it's huge, and probably it's much greater than we're being told. We know that 1,200 or so officers have become infected, and we know that we don't know how many of the prisoners have been infected. We know how many are infected on any given day in the jails, but we don't know the total since the pandemic has begun. But we do know that fortunately, certainly for the incarcerated people, the death rate has been very low. There've only been 3 deaths of people while they've been in custody on Rikers Island, and there are 3,900 people there, men and women there, about 120 women and the rest men. The correctional officers, I said, have had over 1,200 infected, and at least 11 people have died. I think what's most significant is that the death rate reflects the care that people are getting, but also the fact that they're young. Mm. Yeah. And but that also means that for prison, so New York City Rikers Island is a jail. It's a pre-detention facility. Right? These people, in almost all cases, have not been convicted of anything. they're just put in jail because they've been accused of a crime and they're unable to make bail. I'm disjointed, but you'll have this recorded and you'll know what's going on. So the first thing that the board did, and this was not jointly, but it was simultaneous with the doctors who work on Rikers Island, was to call for release of people. So the Board of Correction on March 17th called for 2,000 people to be released from the jails, and we asked for the medically vulnerable, people who had conditions which would put them at great risk, for people over the age of 50, because they are at great risk. Those two groups are at great risk of getting really sick if they got infected, not like a young person. And we were concerned that those two groups in particular would overwhelm the medical capacity of the place. And additionally, we asked for the release of people who are easier politically to be released, people who were serving short sentences. There are some people serving less than a year on Rikers Island. People who were there because of a parole violation. They had violated a rule. They failed to call up their parole officer or something, where they were late, they were out at night. And to get those people off of the island too. And that added up to about 2,000 persons. And within 2 weeks, 1,500 people had been released. So
they have been released. Yeah,
oh,
because
yes.
I read it, and then I read the news, but I didn't read. This was one question.
Oh, no, the population.
They were released. They were released, no?
Yeah, the population was 5,500 when we issued our call, and it's now 3,900.
Oh, okay. So,
which allowed the people to be, which made room to create a quarantine area, or to create an area for people who were infected, or to create an area for people who were symptomatic while the test results were waiting. So I think that was the most important thing that was done. And and a lot of people were I mean, the board called for it, the Board of Correction, the doctors called for it, the city council called for it, and and at least so that was the most important thing, I believe.
But
And
there was
I'm
a
not sure.
protest from the nurses just now. So did they solve these problems, or do they have, because they said they don't have enough
PPE, we call it PPE, the personal protective equipment is our abbreviation, PPE. Certainly, there have been limitations. I don't know exactly what's going on in Rikers Island right now. I mean, because I'm not there, and we've had limited. We issued a report, which you can get on our website yesterday. We issued it on Monday night, the Board of Correction website, in which we used the cameras to record what actually was going on in the best we could. Cameras lie, I mean, we're cameras, just, cameras have angles, and they have directors, not really directors in this case, but so so we made very careful. I'm standing behind all of our conclusions of our report, but we showed that there was availability of masks at this point, at this stage of the thing. Not everybody wore them all the time.
Is the release of the prisoner now in Rikers Island, is it exception, or is it a general thing that they do in the USA, not just now?
Well, it's been done all over the country, and there is I'll send you a link to a database that's maintained, which tries to identify as well as we can. Our country is a chaotic federal system, right? There are thousands and thousands of counties that have their own jails, and their own elected district attorneys, but people have been collecting that information. So, in fact, probably tens of thousands of people have been released from jails throughout the country as a response, as an attempt by jails to get to try to cope with the pandemic, and also on the because of litigation, lawsuits brought on behalf of people inside the jails to get people out. So nowhere near as many as should have been, and no national policy on it. But yes, people have been released from jails all over. Often it's based upon them being close to the end of their sentence or something, or their perceived risk, safety versus public health versus public safety. But the most important thing is to get people who are older and at risk of having terrible complications out as soon as possible.
And how's the health system just now for the prisoners? Because I was told it was some years ago it was quite poor. Is it better now?
Well, it's I ran it, a long time ago, and it's I think it has certain serious problems, but generally it's very good. I think so. That's the adequacy of the number of nurses and doctors and support and pharmacy. That's all pretty good. And the Board of Correction has a set of minimum standards for healthcare and medical care, which are which have supported the necessary staffing to and particularly now with the population so much lower, the health staff is actually designed for a population 3 times the size right now. So, but they understandably are under tremendous stress. It is very hard to be working in an institution where you feel that it's like a cruise ship. It's like a nursing home. People can't get out, and the virus spreads very, very quickly. So, and wearing PPE all day, wearing masks and gloves and gowns is very hard to do.
But because I was reading, I suppose this changed, that there were cells where like 40 people were sleeping together. I'm not sure if this is like this or not. And they said, how is it possible? Because the jail population had reduced by more than 50% over the 20 years. I'm not sure if this is right or not. How do they sleep just now? Or for example, when they eat together, I suppose it's not possible to separate.
Yeah, so in most of the housing areas, and you can read about this in our report where we discuss it, there are less than 50% of the capacity live in each housing area. So it is possible for people to sleep every other bed. Although the department does recommend people sleeping head to toe. I don't think that does much as a way of it's not the same as 6-foot distancing that people need. But it is very hard, it is very hard to social distance in a jail. There are all kinds of times when people are funneled into narrower areas, and you can do it theoretically, but it is very, very difficult. So there's a lot less movement. The consequences of enforcing distancing are to limit movement substantially, and that, as we all know, is difficult, and must be particularly difficult inside where you can't even period.
Yeah. Are they like 2 classes in the prison, that people that have a better standing or whatever, they get better rooms or better rights or something than the others? Or
there is there are, most of the facilities are pretty similar, and then there are some that are more punitive than others. I've been in prisons in Madrid.
You have to talk.
And they're very different. They're very different.
What was the difference?
I went to the one where families could live together. Have you ever been to that one? Yes, I mean, it was quite extraordinary.
How was it called? Do you know the name now?
I'm sorry. It was sort of suburban. It was a number of years ago, and I'll tell you, and it was Spanish policy that couples who were at
Ah,
certain
okay.
low-level offenses could live together with their children up
Ah,
to age 2.
yeah, yeah.
So no, the jails are, I mean, there are high security areas and there are some punitive areas where people are in isolation. We limit the amount of time that people can stay in isolation. Right now, it's nobody under 22 can be in isolation, and anybody who's in isolation can not be there for more than 30 days. That's punitive segregation. But in terms of the positive environments, there's not a lot of that on Rikers Island.
And there is a plan, I think, to close it in 2026. Will it be closed? And what happens after with the buildings and with the inmates? And
I mean, the whole world has changed right now. So I hope it still occurs. I strongly supported it. The mayor eventually supported it. The city council supported it. It would be, the Rikers Island itself is very isolated. I mean, it's right next to LaGuardia Airport, so it's not, it's sort of, it's right there. It's, that's not an international airport, but it's right there. On the other hand, it's not accessible by public transportation. There's most people can't drive over the bridge that goes there. It takes hours for people to get there to visit their families. Lawyers don't have time to go there because there'll be a 4-hour day for 4 hours for a half an hour talk with your client. So having these things right next to the subways and next to the courts, which is the plan for closing Rikers Island, is a very good idea. And the other part of the plan that was most important was that it was going to decrease the population to 3,300. And this was developed at a time when the population was around 10,000. And now we're at 3,900, so we're almost there already.
Yeah, sure. So
Yeah.
one question, because Harold told me so much about this kid, Khalif Browder. Do you think this still could happen, or did they change some things after with this?
I mean, could someone still end up? No, you could not, as a young person, end up in solitary confinement on Rikers Island now. And it was very much because of, I mean, we were trying to get rid of the board was trying to get rid of solitary confinement for young people before his death. But it certainly, that was horrible, tragic. You have words for these things, in every language.
No, the thing is that they have approved things, no? So this could not happen anymore, no?
Yes. Well, and because we have specific rules saying you can't put someone under 22 into solitary confinement. They have to be, they can't, they have to be out at least 10 hours a day in most cases, and almost everybody 14 hours a day. The best thing is not to put people in,
Are there any actions that, for example, I read that there are a lot of poor people because they can't pay the fee to get out. Are they are you trying to lower this fee, or
Yes, well, that's New York actually beginning in January of this year, the bail, we call it the bail laws were changed dramatically, and that was very important in reducing the population substantially, so the only people who are there are very few people with bails right now on Rikers Island, but that's not true. There are a lot of people who have bails, but they have very, very high bails that judges set, usually for very serious accusations against them. Getting rid of bail is very important, and that reduced the population dramatically. It decreased 20% just from December to January of this last year because of the new laws. Unfortunately, the governor just supported, and the legislature in New York State just passed a bill that will reverse some of that. So we are a very punitive society, United States, and we have more people percentage-wise locked up than anywhere in the world. Probably about 5 or 6 times what Spain does, more, and Germany as well.
Why do you think is this like this?
I don't know. I mean, there are certain things that characterize it. I mean, there's race is race. In New York City, 90% of the people locked up are Black or Hispanic, and the population of New York, they're about 50% or 55%. In the state, it's even greater in terms of the racial disparities relative to the population of the state. We have very puritanical notions in terms of drug policy, which are both puritanical and racially motivated. So certainly in the prisons of the country, there are many people there were there for drug crimes. Certainly in the federal system, that's the case. I don't know, really. I can tell you that although there's a tremendous great more awareness of the degree of mass incarceration and the differentness of this country compared to the rest of the world. And in New York City, close Rikers Island, decrease the population. So we live in a place that's very conscious and is changing, where I live. But the total population in the jails and prisons of this country has not changed in 10 years. So despite an awareness, despite Khalif Browder, despite the books and the actual number of men and women in the prisons has not gone down.
Mm-hmm. Okay, and I have 2 questions, and then I know 22. Do you see now that the USA, they have a lot of infections and the death toll is very high? Do you see that they are doing it right just now, the government, to try to control the virus, or are you a little bit concerned?
Well, I'm very concerned, particularly for the prisons. The prisons are for people who were sentenced to, in this country, a huge percentage of the people in the state prisons are sentenced to life imprisonment, called life without possibility of parole, LWOP, LWOPP, and that's and it is filled. Our prisons are filled with people who have these sentences, which mean they will be in jail forever, or they have 50-year sentences or longer than that, and that means that they're older, and the state prisons are not releasing people at this point. Very, very, very few. New York State has not released anybody essentially, and it has 40,000 people in prison. That's the state. That's Governor Cuomo. Has and that's true in prisons throughout the country, with some rare exceptions. So the answer to your question is no. For many jails, there has been an attempt at all levels to get out as many people as is sort of politically possible in terms of who's being released. But for the prison system, which is huge, it represents another 700,000 people, there's almost been no release.
Or the last question is, because we are always asked it, do you see something positive coming from this coronavirus pandemic?
I've never been asked that question before. No, I don't. I mean, maybe it's hard to believe that we don't seem to learn anything from pandemics, right? I mean, it's too hard to imagine what we're going through right now, and I think people will forget it. I mean, there are analogies you can think of our ability to forget about pain, really, really repress it so that it's not. So I don't think so. I mean, except for the in New York City and in the community, who's interested in the wider group of people who see jails and prisons as a problem, as a sin in our society. We do see that work that has been done over the past 30 and 40 years to raise public awareness and to develop a structure to defend people inside in terms of their conditions was able to be mobilized quickly. But that's not something that's good that comes out of it. That's something that came out of years and years of work to be able to, no one was expecting this, but to try to raise the issue publicly and effectively. So it's positive in terms of what's been accomplished, but I don't know the future.